So thanks to some friends being really curious about what it is that we did today at March on the Hill, I just wanted to share a little bit with you all because we definitely ask that you join us, and it just makes our advocacy efforts that much stronger, just like fundraising when we ask for donations for the Cystic Fibrosis Foundation. This is just yet another way that you can support us and you can support King. So I just wanted to share what we shared today with our Tennessee representatives. We had 6 meetings, lots and lots of steps along the way, and they all went really well. It's a great joy to get to talk to people that are interested and curious about our story, many of them who have been following King since birth, since I first met them when we came here to Capitol Hill. So today was a little bit different though, and it seems like it's a really special year out of all the ones that we've come and talked to them. So what I shared today was that when King was born, I created, or with a friend, created this birth announcement for him. But because he was so sick and it was just a lot for me to deal with, it became very overwhelming to even imagine sending out a birth announcement. So I've always kept them though because they were really special to me, and I thought at some point maybe we would share them in some way, and it felt like the right time to do that would be today. We always bring our Christmas card along. We order extra ones every year so that we can bring them here to Capitol Hill to help people just get a little bit of a glimpse of King and Emma, Virginia, and our family and our hopes and our dreams for what the future would look like. So today I brought the birth announcement with it, and what I told them was that this year is really special because just yesterday, clinical trial results came out that showed that finally, after all of these years, there might be a drug that could come to market that would make a really big difference in King's life. It would change the way that his body works with the cystic fibrosis. It could lessen his symptoms. It would mean less weeks in the hospital, which would be incredible, especially after the year that we've had. So it felt like a joyful moment, and it felt like the right time to finally share our birth announcement. So we did that today, and it was really cool, and I think that they enjoyed it, and we left behind our Christmas card too. Another thing that we talked about with them was the drug development pipeline. And if you have logged on to the site where you too can be an advocate any day of the year through the Cystic Fibrosis Foundation, you can find this on there also. But this side that's kind of a pinky maroon tone shows all of these different modulators, which are the ones that we hope are going to be a huge help for King. But it's important to note that that's not helpful for everyone living with cystic fibrosis, and it's a huge reason that we do what we do. We come and walk Capitol Hill the way that we do and talk to so many people and share our story, but in doing so, we're sharing the stories of so many other people that are living with cystic fibrosis too, and we want there to be something for everyone living with this disease. So there's other things in the pipeline too that help King, but also everyone else living with the disease, and we hope that there will be more to come. And so we asked today for robust funding for the NIH and for FDA so that drugs like this can continue to be in progress, go through clinical trials, come to market, that we just can continue that research in a really great, safe way. We also asked today for affordable, adequate health care that is accessible. And that's been something for years that we've talked about. It's so important because, as I said today to so many people, this is amazing. The drug that we feel like could be available to King, we hope will be amazing. Our care center is amazing. All of these things are fantastic, but really they boil down to a big, beautiful abstract painting hanging on a wall if we can't access them and if we can't afford to do them for King. So it's so important that we share the message of affordable, adequate care that is accessible to all people. Thanks so much for listening. Thanks for being along for the ride today. And as always, if you have any questions about cystic fibrosis, or you want to know anything about King in particular, or any of the ways that you can help, we would just love to talk to you about that. And it's such an honor to get to share our story with you. So, bye from DC.